Hi, I'm Julene Samuels, and I'm a plastic surgeon in Louisville, Kentucky. But more importantly, I may be just like you. I'm an aging woman, and I am quite actually menopausal aging woman. And one of the things I wanted to talk to you about today is what we can do for women who are either postpartum and suffering from vaginal relaxation syndrome, or perimenopausal and menopausal suffering from vulvovaginal atrophy. So those are big words, and what do they really mean? Many times after childbirth, women will just not feel the same as they did prior to pregnancy and delivery, and that can be due to stretching of the vaginal tissues. Many patients also at that point may become bothered by stress urinary incontinence. So one of the things we have done with some of our laser devices and radio frequency devices that we use in other areas of the body is we've extrapolated that data and that experience with patients and used it to now offer patients some help in these areas of female intimate wellness. After weight loss, a traumatic delivery, a large baby, the vaginal tissues become lax and stretched. This can also have detrimental effects in terms of sexual function, sexual dysfunction, and difficulty achieving an orgasm or being intimate with one's partner. And many women lose self-confidence when this occurs. One of the other things my practice offers women is surgical labiaplasty. So we can reduce some of the redundant tissues surgically. But with these two devices that I would like to talk about today, one being the CO2RE Intima fractional CO2 laser, and the other being a radio frequency device called Votiva Forma V, we can deal with laxity. We can also deal with postmenopausal changes of dryness and itching and painful sex. Many times in menopausal years, women will become tight and dry, and they can have frequent vaginitis, infection, and also stress urinary incontinence. So with the menopausal patient, we're looking to restore natural lubrication. We're looking to make the tissues more elastic and flexible, especially during intimacy, and to help many women achieve control of urinary incontinence. So we have a large demographic of ages of women that these devices apply to. When we do either a Votiva radiofrequency treatment or a CO2RE Intima treatment, these are in-office procedures. No anesthesia is required. There's really no downtime. They're quite comfortable. And we do the treatments typically with the radio frequency device. It might be a 20 or 30-minute treatment. With the fractional CO2RE Intima, it's more like a 10 or 15-minute treatment. We treat the patients internally, and then we can also treat the external vulvar tissues, which with age and maternity can become hyperpigmented and lax or deflated appearing, and we can tighten those tissues and treat hyperpigmentation very nicely with both devices. So finally, we have an answer for some of the common problems that women would talk to their doctors about and have very limited options for, especially if they did not want to use hormone replacement therapy, or perhaps in the instance of a patient who has had a hormonally treated cancer, the inability to use estrogen. Many of the menopausal changes are due to lack of estrogen as women age. So we are achieving great success. We did a study last year on the CO2RE Intima for Syneron Candela, and we had a 90% response rate for dryness, itching, and painful sex after the first treatment. The treatments are done at 1 month intervals. After the second treatment, the response rate climbed to 97%, and after the third treatment, it was 100%. So our patients are telling us that this is really a life-changing treatment. So if these symptoms are something that you struggle with, you might really want to come and talk to us about what your options are.